So I'm Rahul Sharma. I'm an interventional cardiologist originally from Melbourne, Australia. I've now been in the United States for 7 years. In fact, yesterday, which somewhat solemnly marked the 1 year anniversary of COVID, in happier terms, marked my 2 year anniversary here at Stanford in the Bay Area. Prior to that, I was in Los Angeles at Cedars-Sinai Hospital. I am an interventional cardiologist, which means I specialize in interventional or invasive procedures, albeit in a minimally invasive fashion for the heart. A lot of you may be familiar with coronary artery stenting, either having personally or through your family or friends experienced such procedures. That's kind of the basis of what I do, but a further subspecialty interest of mine is what I call structural interventions. It's a field where basically I'm able to minimally invasively repair or replace valves or fix leaking valves or holes in the heart. I'm also the clinical associate professor of medicine through the Stanford University School of Medicine, and I'm heavily involved in teaching. Perhaps more relevantly to this topic of COVID-19 and cardiovascular disease, I myself actually contracted COVID right at the beginning of the pandemic. I was very fortunate, unlike a lot of others, as you heard some of the sobering data that Ram presented at the start, was minimally asymptomatic. In fact, I had very little in the way of symptoms. And the, I guess, most adverse effect of my brush with COVID was the fact that I was required to quarantine for a total of 4 weeks because I kept recurrently testing positive. It was quite an enlightening experience and certainly gave me a sense of empathy for all of those people after me who contracted COVID and were required to quarantine, but also gave me a very interesting perspective of being a patient on the inside, having these repeated tests. I want to share with you today what Stanford has done and how our journey at Stanford has changed for patient care, particularly as we have continued to learn. Obviously, at the beginning of this journey, we all had very little information. There was a lot of misinformation and misunderstanding, which perpetuated a lot of sort of fiction. And as time has passed and we've gathered evidence and we've gathered experience, we've learned a lot more. And so too, similarly, Stanford has mirrored that learning experience and changed the way we practice. So when we started, I think Stanford and in general, the Bay Area were very quick to lock down. And I think there's no doubt that those centers around the world and certainly around the country that responded rapidly and effectively to this pandemic had some of the best outcomes in terms of mortality rates. At Stanford, we were very fortunate that throughout the entire pandemic, we never really found ourselves overwhelmed in terms of our bed capacity being limited or having a significant number of patients in the hospital at any one time who had COVID or those who were in ICU. And I think that was for two reasons. I think the first was our geographical location. We're surrounded by a lot of other hospitals in neighboring region, which were harder hit and bore the brunt of the virus. I think the second aspect is that our response to it was very rapid and very effective. Stanford ceased all elective and what we deemed unnecessary procedures. So any cardiac procedures that were thought to be elective and in those patients who were not overly symptomatic or procedures that were not deemed to be urgent were delayed in anticipation of a potential surge and keeping those beds available for patients who may need them more. Additionally, a lot of physicians were redeployed to wards or areas of need to help manage patients who needed ventilators, patients in the ICU, or to manage COVID-specific wards. There was a very rigorous policy in terms of identifying high-risk patients and trying to keep those patients isolated away from the general patient population to mitigate the spread within the hospital environment. There was very rapid and widespread testing for physicians, staff, and patients alike. As you probably know, Stanford's at the forefront of developing some of these rapid testing assays and widely disseminated. On a research front, Stanford was very active, and the Stanford infectious disease specialist very active in collecting data and mining that data to try and understand the impact of COVID, at least in the Santa Clara County and the wider Bay Area. And you'll see on my screen here, it's just a snapshot from the Stanford website, which since Stanford began just over a year ago now, constant daily updates on what was happening with the pandemic in terms of facts and figures about the total numbers, the total number of cases, the total number of positive tests, the fatalities, and more importantly, where to seek testing, and now, as is currently relevant, where to receive vaccine. As the first wave and then the second wave hit and things started to settle down, there was more widespread testing. It appears the curve was flattening, particularly with the introduction of vaccination. We've seen a change or a shift in the way that patients and also physicians have curbed their practice. So initially we saw a big dip in terms of referrings to clinic, because obviously a lot of referring physicians themselves were not seeing patients. A lot of them were advising patients to avoid hospital unless it was immediately necessary. As you heard from Sam, there was perhaps an overkill and the pendulum swung too far the other way, and a lot of people were staying home despite needing to seek urgent care. Once things settle down, we've seen that patients are slowly coming back, referrings are slowly sending more patients, people are coming back to work, and particularly as the vaccinations are being rolled out, I think there's a greater sense of comfort. And that's certainly being reflected in what we're seeing in our practice. The hospitals too have responded and lifted some of the restrictions on the procedures that we're doing. And so I can tell you that right here today, at this point in time, we are now completely open for business, as are a lot of other hospitals around town in terms of doing the full gamut of procedures, both elective, urgent, and emergent. I think I'm seeing, at least in my clinic, that the level of comfort of patients has also increased, where patients before were preferring to stay at home or not come in for procedures, even if we deem them to be urgent or necessary. Now there's certainly a greater awareness and also a willingness to come on in. I think a lot of patients who are getting vaccinated, particularly the elderly who are part of that first wave of recipients of the vaccine, are certainly happy to come in even in person. The introduction of the virtual visit, I think, has revolutionized medicine and will probably stay for a long time to come. It's certainly allowed us to be more efficient and to streamline perhaps what were unnecessary visits in person previously, albeit for a different need arising out of a lack of willingness to spread the virus, has now become a practical event. So for example, patients or family members that live far away that simply need a virtual interaction, this has provided a real panacea for this to occur. I think moving forward, as now that we're open completely for business and we're seeing a lot of patients coming through again, it's about educating, encouraging, and this is one of the reasons that we're doing this here, and that is to reiterate what Sam was saying, in that we now have a much better understanding of COVID. We understand that it has a significant and serious impact on cardiovascular health. You heard a lot about how the virus can directly and indirectly affect a lot of the body systems, particularly the cardiovascular system. And so if one experiences any symptoms, there should not be any hesitation to come into hospital, particularly now as we're entering the flattening of yet another curve, as a greater proportion of population is being vaccinated. I can tell you the experience at Stanford at the moment. I tell this to my patients every week in clinic. You have a lower chance of contracting COVID and having a serious illness arising from COVID from attending hospital for your health-related issue than the risk of not addressing your health-related issue. So if there's any doubt, come into hospital. It's a very safe place to be. Currently, they've only just recently lifted the restrictions on visitation. Up until this week, no visitors were allowed. As I said, any patient who has an unknown COVID status or is deemed to be high risk is isolated. They're isolated in a separate ward. We do their procedures in a separate room. And so there is really little to no risk to other patients. In addition, as staff members and physicians who are treating these patients, everyone is, of course, required to wear a N95 or equivalently suitable mask at all times. Social distancing is maintained even within the hospital. And so I would argue that at this point in time, at least for Stanford, it is one of the safest places to be. So moving beyond that, and speaking of procedures, I just wanted to give you a little bit of a flavor of what you could expect if you tune into the next segment of this session on March the 27th. As I mentioned at the beginning of this talk, my particular subspecialty interest is that I'm the director of the transcatheter and structural heart program at Stanford. And so what that means is that I subspecialize beyond just opening up blocked arteries with stents in replacing and repairing valves in a minimally invasive fashion. Previously, for those who've had any interaction with valve replacements or repairs, this was done through an open heart procedure. In this day and age, for those of us who have a certain subspecialty expertise, we're able to do these through an incision that's less than 1/3 of an inch through the groin, more often than not, to replace or repair a valve and entirely avoid open heart surgery. For patients that have leaking valves, we're now able to apply clips to their valve through a vein in the leg, again through a minimally invasive incision. And for patients who have a very common pathology of atrial fibrillation, who have a high bleeding risk, we're now able to offer them a procedure, which again is minimally invasive through the vein, to reduce their risk of stroke and take away their need to be on a blood thinner for that vast majority of patients who have atrial fibrillation. So that's just a little flavor of what's on offer if you tune in next week, the next session, as I'll go deeper dive into the whole gamut of procedures offered at Stanford in the cardiovascular space, focusing particularly on what's new and exciting in this field of interventional cardiology, and a lot of the things that are unique just to Stanford, being one of the cutting edge centers in this country to offer interventional cardiology care.